you really need to stop comparing yourself to the person you were before your diagnosis.
Yeah.
You need to stop, because now you are in a different phase of your life,
Yeah.
And the more you keep on comparing yourself, there is this feeling of loss, this feeling of I'm not that good. I wish I could. I used to do. It's exhausting. It's frustrating. And you kind of feel that you're going backwards all the time.
Mm-hmm.
I say, okay, look at yourselves from the moment of diagnosis. Okay, here we are. What are the steps you have done already? Look how far you have come. Look at everything that is behind you already. Look at everything you achieved. And then what are we going to build from here on? And compare yourself from that moment on, not before. And these simple shifts can really make a big difference. And suddenly, this guilt, this kind of feeling of constant loss, of frustration starts to slowly disappear.
All right. Good evening to Isabel Galiano. And it sounds so, I don't know, fancy, amazing. It's such a good name.
I like my name. Thank you. Good
You
evening.
should. It's awesome. And we're going to talk a lot this evening. We're recording in the evening about just the different stages of cancer, I think we'll hone in on, and what you're doing and the people that you're affecting and the community that you've built, and being a cancer survivor yourself, what you went through, and then how you've translated that into this kind of amazing work that you do. So can you start by just telling us a little bit about you and your own cancer journey?
Yes, of course. Thank you for inviting me. So this is a topic that is, of course, very, very dear to my heart. So as you mentioned, I am a cancer survivor myself. So my name is Isabel Galiano. I am a cancer coach, but I was actually first introduced to cancer as a caretaker. So I was the caregiver of my mother. So she was diagnosed with actually a colon cancer at the age of 50. And I became her main caregiver. And that's really where I realized how much a cancer diagnosis affects every aspect of your life. So that's kind of the first experience I had very close with cancer. My mother unfortunately passed away after 3 years. And 5 years after her passing, I was diagnosed with breast cancer.
How old were you?
I was 32. I actually just came back from my honeymoon. Like 1 week after coming back, I was rubbing some cream on my body because I had a little bit of a sunburn, and I noticed a lump, a very clear lump here on my chest. I always like to explain it. So it felt really like kind of a hard chickpea. So it was very distinctive. And immediately I had this feeling throughout my body, oof, this is something serious. So I immediately went to contact my doctors, and how it goes, at the end, I did receive the diagnosis that it was breast cancer. So it was stage 2, triple positive, HER2 neu positive breast cancer. And so I went through all the treatments. I had a lumpectomy done first, then I had chemotherapy, radiotherapy, hormone therapy. And as everybody knows, going through this journey, it was a tough time, but I made it through. And I thought that I would never, ever had to deal with cancer again. But unfortunately, less than 2 years after being declared cancer-free, I had a recurrence from my breast cancer on exactly the same site.
Oof. Okay. That sounds very awful. And so what happened then? And how did you find it the second time?
So the second time, actually, as I mentioned before, we were just married and our first plan was to try to get children. So of course, because of the cancer, I had to postpone that. And my doctor said, after 2 years, we can look into it. Maybe you can try. So I was very hopeful. I went to see my doctor in the idea he will give me the green light to start trying to become pregnant, but he ordered a range of tests. And unfortunately, in the MRI, they noticed that exactly in the scar of my first surgery, there was a tumor growing again. So, of course, everything was upside down. So instead of trying to become pregnant, I had to have more treatment, additional surgery, and I was off again for the ride that I've gone through the first time. But this time, I have to say that a lot changed for me, because the first time around, I was very pragmatic. I was really kind of in autopilot mode, doing everything the doctors told me to do, but also nothing else.
Mm-hmm.
So this time I thought, okay, what did I miss? What areas did I neglect? What are some aspects in my life that I actually did not take care of? And there was a deep moment, of just looking inside and being very honest with myself and just starting to write down, okay, how about my stress levels? How about my sleep habits? How about even dealing with all of this? The death of my mother, my diagnosis, not being able to have children immediately. So all these aspects. And then I decided to start studying. I became a health coach. I very quickly understood the importance of nutrition. So I also got qualified in nutrition and in functional medicine. And it was really mainly to build a toolbox for myself to recover better, to get through treatment better, and to really put all the chances on my side that it will never come back again and that I won't have to go through this a third time. I didn't want to be, again, this kind of passive observer.
Like a guest in your treatment. You became
exactly like
the
things
main
happening
character.
to me and me just kind of blindly following. I said, okay, this time I kind of want to feel that I'm in charge. I want to feel that actually my action are powerful, that I have a way to contribute to all of this. And even if it's only psychologically, emotionally, it puts you at a much better place to kind of feel in control, feel like you're actively doing something. And so that's really the spirit that I had the second time around. And I learned so much, and I'm still learning. So I've been now almost 20 years cancer free. So I'm going to be 52 actually in 2 weeks.
Happy early birthday.
Thank you very much. And so this kind of passion and everything I learned, I felt, it needs to go out there. I met so many women in the hospitals who were like me, who didn't know how to kind of contribute to them feeling more in charge, but also to feeling better, to enhance their immune system, feel more energetic, to have less bloating, to all of these things. So that's how I decided. I always knew I wanted to support breast cancer patients. I never really knew how, but then it just was obvious. It's coaching that I want to do. I want to coach women throughout all the phases, from diagnosis, preparing for treatment, getting through treatment, recovering from treatment. And then the period often very much misunderstood is the whole recovery and then getting back to life after this trauma.
Yeah. So you didn't have a double mastectomy your first time.
No.
Did you have a double mastectomy the second time?
So I had a mastectomy the second time. And then I decided to go for preventative. But it was not necessary for the doctors, but for me, that was my decision.
And did they ever bring that up the first time you were diagnosed?
So the first time it was really, oh, you are so young, and you have all your life in front of you, and there's no need. I mean, I remembered asking, and it was very clear in their mind that there was no need for it. Yes, but I try not to look back and think of what if.
No, you can't. Oh my God.
Exactly.
You can't. No.
And honestly, as much as it was, one of the scariest thing to go through a recurrence, because the first thing around is like, I can do this. I will survive it. I will power through it. But the second time around, I felt that the fear, the uncertainty was just so much deeper, because I said, I did all the treatment and it didn't work. So
Yeah.
who says it's going to work this time around? So emotionally, I think it was much more profound of an experience. But I really often say to myself, if I wouldn't have gone through that, I would not have learned everything I learned. I would not have been doing this amazing career that I love so much. And who knows how my health would be right now. And now I know how to take care of myself. I know what I should be doing. And I feel really empowered. And that gives me a beautiful kind of sense of that somehow the whole journey made sense.
Of purpose.
Exactly.
Talk to me a little bit, to rewind, about the period of grieving your mom and how quickly your first diagnosis, you said, was 2 years after your mom passed. And she was so young and you were so young. Do you have a sense of that time? Because to me, that's like so profound.
Yes, so I think that there is a lot that is kind of hidden somewhere, is a protective mechanism that you don't want to remember, the really kind of deep moments of sadness and of frustration and of helplessness. My mother passed away when she was 53, and she really went through a lot of suffering. So the whole 2 years were really profoundly traumatic, first of all, for her, physically, emotionally, financially, on a family point of view. And so at the end, she spent a lot of time being unconscious. We had, in all that pain, a lot of time to get ready, which from some point of view, that was helpful. So we knew it would be coming. And it is difficult to talk about it because I think that when people haven't lived through something, it's difficult for them to understand. But there was a sense of relief when she passed away because she clearly expressed that she didn't want to live like this anymore. It was really only suffering. And when it became clear that there was really no way that the cancer is going to stop, the first thing was kind of a relief.
Yeah.
And then it takes a while until you feel the sense of void. Because there's so much to do, you have to get everything ready, funeral, family. But then comes a moment where you really feel that deep void, because from being a 24 hours, 7 days a week caregiver, suddenly, there was this void. So I had to very quickly fill up this void. But I have to say that for me, my feeling was, what she was not able to live, I'm going to live. I'm going to live for me and for her. I'm going to have the joy that I deserve and that she unfortunately didn't have to live. I'm going to do the most out of my life for both of us. So that was really the spirit. And I have to say that I very quickly after that fell in love with the person that is now my husband. I got the job of my life, the dream job. So everything was really going into that wonderful, beautiful life that I promised to myself that I would have for me and for her. So that's why I was so shocked when actually 5 years after her passing, I received this diagnosis, because never, ever would I have thought that this would kind of happen to me at such a young age. I was 32. But again, I would say that the reality of me passing through all her journey made me kind of a bit more professional. I knew what was chemotherapy. I knew the doctors they were the same. I kind of had already learned a lot of things. There were so many trials and errors that I had not to go through. So in that sense, it kind of helped me. I'm a person, I always try to see the positive side. So I try to see it in that way. Take everything you learned and just use it for you. And so I have to say that my immediate reaction when I got the diagnosis is, I will make this. I will make it. I am not my mother. Unfortunately, she had a different situation. My situation is doable. I will get through this. I was very, very optimistic and very determined to fight this.
Yeah. My mom was also 53 when she died of cancer, and she had ovarian cancer for 5 years. I was younger than you, a little bit younger than you when she passed away. I was 21. I was not her full-time caretaker. She didn't really even actually need one. She probably would have refused anyways until the very end. But I remember something in my head clicking that you have like a choice in that moment, right? Right after, where it's like, is this going to kind of swallow you and define your life in this really kind of morbid, sad, depressed way? Or am I going to take the path where it doesn't swallow me and I figure out a way to not use that experience, but hone in on what she went through and I witnessed so that I can do better for whoever becomes my community. My brain wasn't as eloquent back then. I was so young, but I do recall that moment. And I've seen both sides. I've seen the lemons into lemonade that you've built, that I've built through this foundation. And I've seen the other. I really have, up close and personal, where you just can't get over it almost. And it defines your life, this deep sadness and maybe regret too of what you did for your mom, how you were with her. And there's something so powerful about the life that you've built. And you clearly wouldn't be able to do this without not only your own experience, but in your own cancer journey, but also bearing witness to your mom's. So just talk to me a little bit about how you've built your business, which it's weird calling it a business. I feel like it's your life's journey and what that means. Like, what is that as a day-to-day? What does that mean in terms of the women that you work with?
So, for me, it was really kind of this moment where I realized that I wanted to do something out of these experiences. I was a caregiver. I went through cancer myself. I went through all the treatments. So I had a really deep knowledge of all of them. I went through a recurrence. So I said, you need to do something positive and constructive out of this. And that was really kind of the drive. That's how, as I said, I start coaching women going through this. And at the beginning, when you start something new, you are all excited, but you are also kind of green. And I always felt like I have to give all this advice. So I was so keen on having all these lists on what to advise when you do this and when you're in this situation. But you really learn throughout the journey. And with every single person I've coached, I learned so much. And I really learned that the first thing we all need is just a space. Just a space where we feel heard, understood, where we feel allowed to kind of voice out any feeling, any emotion, where it's not judged, where it's not, criticized. That's kind of the foundation also of my coaching, to really offer that space where
to me, it's like feel all the feelings.
Exactly.
And really feel them, allow them to be felt.
Allowing you to feel them without guilt, without worry, without feeling, that you will be judged, criticized, and this pressure of feeling positive all the time, of pretending that you have it all together, of making sure nobody around you worries for you, you are not a burden for them, and that you kind of need to show, I can do this, I am positive. It's really exhausting. So I find it really important to offer that space. And from there, everything starts. Because once you lay that foundation, then we build on it. And then it goes into the more practical aspect. And it goes more into, okay, where are you right now? What are the next practical steps that needs to be taken? And how can I best help you? And this can be with emotional support, but also very practical help on explaining what to expect, what to bring to the hospital. Often it is like a list of questions to ask the doctor. Because what I also always say is that when you are in that state, you are going through a trauma. And I always say you are kind of in an altered state of mind. So things that might be very logical and evident for people around you, you kind of skip it because it's so overwhelming that sometimes you forget to ask the more basic questions. And so it's important for me to kind of make sure that they have that foundation, that they know what is happening, that they understand why they are doing what treatment, and that they get all the tools to feel ready to go through it. And then we go into very individualized kind of aspects. For some, it's, making sure that they sleep better, making sure that they have a good communication with people around them. Sometimes it is really also, how do I manage it with my workplace? How do I inform my boss? How do I handle that situation? So everybody has different priorities, and that's all fine. And they all need some support, some guidelines on how to kind of go through that. So in my day-to-day, to answer to your questions, I see my clients one-on-one, either here in Singapore in my clinic or online. I have clients all over the world. I coach in 5 different languages. But I also really make it a point to give a lot of talks where I get to talk to many more women, and where I can share information, where we do also very interactive sessions where they feel heard and understood. And also, I really use my platforms like my Instagram to share a lot of this kind of wisdom that I learned, and to make women feel heard and understood. And I have to say that the message that I get, I would not say every day, but probably every second day, is you manage to put into words what I feel and I don't know how to express.
Yeah.
And that's an important mission for me.
That's amazing. I mean, that's not light. Heavy's the wrong word, but that's such important, crucial work. And I think the thing that, especially when talking about women who have a cancer diagnosis, there's this expectation that we'll still be able to do everything we always do and just also do this. And I think that expectation is one that we put on ourselves. And then, the trauma then compacts, like it compacts in your brain and then expands because it's not given that space to let out, right? And I think for women, I've noticed in women that I've talked to who have had a cancer diagnosis or have beat it or have lost someone and watched them go through it, that's sort of the negative thread that I see so often. People who don't have a coach or a specific person who's helping them feel the feelings and let them out, is this idea that you have to sort of just battle forward. And that's not going to work most times, right? And if it does work clinically, then there's psychological and emotional, I don't want to say baggage, but psychological and emotional experiences that you're not allowing yourself to go through, which will catch up. And it usually catches up. So I don't know, your work is so amazing. And the idea that you do it in 5 languages is bonkers. It's so cool.
So if I just may say something to what you just said, because I think it's very profound what you said, that women kind of impose that to themselves. And that's very true. That's very true. I also coach some men, and they have a bit of a different approach to it. And women kind of have this feeling, I still need to be the perfect mother, the perfect wife, the perfect sister, the perfect daughter, the perfect friend. So most of the pressure really comes from themselves. There's always this guilt that comes along this journey. I'm not able to do as much as I used to do. I wish I could do more. So one thing that I really often say, and I think that it makes a big change in perception, and it's often an aha moment. I always say, you really need to stop comparing yourself to the person you were before your diagnosis.
Yeah.
You need to stop, because now you are in a different phase of your life,
Yeah.
And the more you keep on comparing yourself, there is this feeling of loss, this feeling of, I'm not that good. I wish I could. I used to do. It's exhausting. It's frustrating. And you kind of feel that you're going backwards all the time. I say, okay, look at yourselves from the moment of diagnosis. Okay, here we are. what are the steps you have done already? Look how far you have come. Look everything that is behind you already. Look everything you achieved. And then what are we going to build from here on? And compare yourself from that moment on, not before. And these simple shifts can really make a big difference. And suddenly, this guilt, this kind of feeling of constant loss, of frustration starts to slowly disappear.
Oh, I think that's so amazing. It's so important. It's interesting. I was a teenager and then, my early 20s when my mom was battling cancer. And I thought it was from my perspective, a 16, 17, 18-year-old, I thought it was so admirable. And so my mom, it was so her that she wanted to live her life as normally as possible. And by normal, that meant what she always had been and the person she always was up until that day of diagnosis. And when I was younger, I really thought that was amazing. And that she showed up and when she lost her hair, she got a great wig and she put it on and she was always dressed as often as she could. Obviously not during, right after a treatment that knocked her out or whatever surgery she was having that she had to recover from. But any of those days, in between, she really worked hard to be the same mom she always was, to be the same wife, to be the same friend, to be the same everything. And as I got older, I realized how effing exhausting was that for her and frustrating. And she must have felt like she was literally running in circles, like a chicken with your head cut off, just keep trying to achieve something that was impossible. She was fighting cancer and having treatments every 3 weeks and surgeries and complications. But no one gave her that advice. No one told her that. I don't know if she would have listened if someone did. Who knows? But it makes me feel for those 5 years of her life because she did really well and she did the best she could and she knew how to do with the tools that she had. But I do think it was so exhausting. It was just so exhausting beyond the fact that you're physically so exhausted because the medications and chemos and radiation and treatments that you're getting are physically beyond draining. I mean, it, wipes out your whole immune system. So what you're starting with your platform and your clients and everyone you're reaching out to, I don't think can be minimized. I think it's truly probably the most pivotal piece, I think, that a woman, especially a woman, can take away, God forbid, they're diagnosed with cancer.
And I think when I listen to you, I think it's also important to understand that it's not black or white. And that's what we really discuss. I discuss with every single woman or when I give talks, is you need to kind of find your way because to some point, being kind of active like you were before, giving you some moments of normality, it's also very healing to have moments where you are not the cancer patient, where you feel like I was at that time, I was CEO of a radio station. When I would go into my radio station, I was in charge, I was not the cancer patient. That feeling was really important for me. When I was in a meeting, I was the one taking the decision. And I needed that to kind of compensate the life as a cancer patient. I think where often women go wrong, and I certainly did the first time around, it's that it's only that. And we need to compensate it. And we need to just allow ourselves and be very honest to ourselves that we do need more rest, that this is really tough, and that the more we take care of ourselves while we go to treatment, the better the recovery and the kind of the long-term side effects are very much impacted. I see that every day with my clients. Those who kind of ignored, let's say, peripheral neuropathy, when you start having your hands and feet who feel very uncomfortable because of the chemo, when they completely kind of ignore it, continue, it can go on for years and years and years. Those who have worked on it, they recover from it much faster. And I can give you many, many examples. So yes, to some point, it is important to have moments where you feel normal, where you have that normality in your life, where you feel in charge, but you need to compensate it with moments where you recharge, where you kind of go to that place where you know that you need to take care of you. And that's another aspect for women that they really need to learn, which is a big aspect of my coaching, to put themselves first. Because most of these women, and it's a very common thread between women who have actually had specifically a breast cancer diagnosis, that they always put everybody else first. So learning how to put that into action. What does that even mean, to put myself first?
I always say put your mask on first.
Exactly. How do you do that practically?
Yeah.
So you have to coach them to that, because you have done that for your whole life often. And then when your kid comes, oh, mommy, I need this and this for school. Of course, I run and get it. Your husband asks, you kind of always leave everything and you run to fix everything for everybody around. And to then have that moment of reflection and say, wait a minute, how does that impact me? Is that really my first priority in this moment of my life? You need to have that moment, that reflection, and then take a decision with your health as the number one priority.
Yeah. There's a gal who is part of our greater foundation family, let's say, and she became involved because her dearest friend, sort of cousin, passed away from breast cancer, and she was 50. And her big takeaway was that she just wanted to know what to say, and she wanted to be able to help her better. And I actually think this piece is the fundamental piece as a coach and as a friend and as a loved one to someone who's been diagnosed with cancer, who's going through cancer treatment. To me, this is like the nugget of gold that you can give to someone, is to encourage them to do what you just, eloquently described, which is so hard because we probably don't do it ourselves, but I think it's such a wonderful piece of knowledge that we can then, digest, because the reality is at some point you'll know someone who's diagnosed with cancer, whether they're your best friend or your mom or your sister or your daughter or your aunt, or just someone in your community. And arming ourselves, I guess I would say, educating ourselves with that nugget of information that you can then pass on is so meaningful. So meaningful.
It does make really a tremendous, tremendous difference in somebody's life who is going through that. And I believe that communication skills are essential. And I really talk a lot about that to the women who come and see me, how to improve their communication towards their partners, towards their children, towards their colleagues, so that they learn how to express their needs and how to express it in a way that is kind of not demanding, but firm, that is kind, but very kind of self-confident too. So it's important to also find the right word when you want to get a message across. The importance of silence and letting them talk and just being present, and not immediately jump into advice and solution mode. So all these aspects are truly important.
Yeah, that's amazing. First of all, I just have to know, how did you end up in Singapore?
Okay, so I was born and raised in Luxembourg from a Spanish father, a Belgian mother. I married a Mexican and he got an offer from a bank to come to Singapore. And, I just finished all my treatments. So I was just done with my radiotherapy. I was still bold. And when this offer came, for me, it was, wow, it's like a new start.
Yeah.
I dearly loved my job. But I felt like it's like a great way to kind of leave everything behind and start over an experience, an adventure. So that's how we landed in Singapore. And we've been here for 19 years now.
Wow. Yeah. I think that's, kind of amazing the way that lined up. It almost gave you an opportunity to not reinvent yourself, but, as you were saying, that when you are diagnosed with cancer, it's like that's a new chapter. And in many ways, yes, look back to be norm, but we have to move forward from here. And so when we're cancer free, to be able to then start another new chapter, and also physically,
Yes.
like that's pretty powerful.
And I think that it's really important to understand that once you are really healed and you go back to your life, you're still confronted with it all the time, let alone because of your physical aspect. Many women lose all their hair. So you are still daily confronted to the questions, to the looks, to the doubts, to so many things. So for me, it was so liberating. I arrived here in Singapore. I had like very short hair, but people met me like that. Nobody asked me, why did you cut your hair? Or where is your hair gone? Or you look different. Why are you so puffy? Or, you kind of, all these questions were suddenly gone. I was not being confronted to it, not having to constantly explain, put on a brave face. It was so liberating. But I also understood how difficult it is for women who have to go through that every single day. And this phase of after cancer is a very lonely phase, because that's where kind of everybody around you thinks, oh, that's it. You are done. Yay, let's celebrate. You can go back to normal. And as much as you wish it would be that easy, you very quickly realize that it's not, that there's so many side effects that still linger. You still have a lot of doctor's appointments. Suddenly the fear of, the next appointment, the next scan, recurrence kicks in. Your energy levels are not the same. You really kind of are in a moment where you kind of lost your identity and you piece it back together, while everybody around you looks at you as, what's the problem? Everything is over. So it's a very lonely experience where a lot of women feel misunderstood, feel judged. And a lot of my coaching is around that period too, to give them the tools. And first of all, to shed away the guilt and to make clear that this is very normal, that it's not them. Because most women think, why am I like this? Why am I feeling like that? So yes, I think that for everybody around, it's important to understand that this period also needs still a lot of support and understanding.
Yeah. From what I've seen as well, it's often pushed aside, mostly because women want to get back to normal without understanding that past normal is past and it's this new future normal. And
also okay to give yourself grace, and you never know kind of when it's going to hit you. Sometimes you are good for a few years and suddenly you have an anxiety attack, or you had a dream that kind of triggers a lot of emotions, and that's all okay. So everybody has a very personal way of dealing with this, of healing, of recovering, of finding their way. And there is no right or wrong way.
Yeah, that's amazing. Well, I want to thank you for all the work that you do, for sharing it with us. And the women that you help, and men, are so lucky. I think it's such a blessing to be able to have you in their life and to help coach them through what is a really, intense and sometimes really horrible, deep, dark time, but getting them through it by using the tools that you've learned and that you then pass on, I think it's pretty amazing. I mean, it's really lemons into lemonade. It really is. So
thank you.
Someone
I
in
appreciate
the adjacent community, I say thank you.
Well, it gives me, a lot of purpose, and it gives me, as I said, this feeling that it all makes sense. That at least, the things I went through, now I can use it in a positive and constructive way. And that gives me a lot of, a sense of fulfillment, I would say.
Yeah, it's amazing. Well, thank you so much. I could certainly talk with you forever and ask a million more questions, but I'm going to leave it there. And so thank you so much, Isabel. This was really wonderful. And I think really important for a lot of people to hear. So thank you.
Thank you for having me, Amy.